Dr. Emilia Skirmuntt, who's a virologist at the University of Oxford. Dr. Emilia, welcome. Early days, I appreciate that, and I accept an unfair question perhaps. What more do we know about this variant?
At the moment, we don't know much. Still, the only thing which we can confirm for sure is that this variant has more mutations than the variants we've seen before. And some of these mutations are known mutations. Some of these mutations we haven't seen before in any other variant. So we still cannot say for sure if it's more transmissible, if it can evade immunity. There is a risk that can be possible, but we need more lab tests to be performed before we can say for sure if that's the case.
What does this mean for the global vaccination program?
At the moment, it does not mean anything because, as I said, we don't know if this variant can evade our immunity at any level. But even with Delta variant, we knew that the vaccinations are a bit less effective. Saying a bit less effective doesn't mean that the vaccinations don't work. They do, and they can still save us from severe disease or death from COVID-19.
Do you think that the measures applied globally at this time are sufficient to address the emergence of Omicron?
At the moment, hard to say. Obviously, different nations have different restrictions implemented at the moment. So these variants, we found it just recently, but probably it was spreading in many countries for weeks right now. So probably it's already in the countries which implemented restrictions at the moment.
We always knew, or the scientific community and the medical community always warned that there would be new variants, surely. I mean, how long realistically are we going to fight this pandemic if the virus continues reinventing itself every few months?
Obviously, it changes, but it's not the case that it changes fully. It cannot change to the level that it will be a completely different virus. So still, we had vaccines. We have right now also medications. So there is no plausible scenario that we will be again at the beginning of the pandemic as we were last year. So we still have tools with which we can fight this virus, and that didn't change.
There will be mental health campaigners, businesses and governments around the world who simply despair at the talk of further restrictions, international travel bans. Later in this programme, we're going to be talking to the South African president, who is deeply disappointed by the tough policies adopted by some governments in stopping international travel. There is a danger here, is there not, of huge overreaction?
That's true, but again, we have been in this pandemic for 2 years right now, and we have, as I said before, tools to fight it. But when there is new variant, we first need to have time to do all these tests to see what we are against. And still, it's the same virus. The fighting against it is the same. So vaccines, masks, social distancing. We just need to have more data. We just need to know if it's really more transmissible, if it can evade our immunity, and that will just take time.
And very briefly, what do you say to those people in many corners of the world who will simply say, do you know what, it's simply time to live with this now and let the world get back to work and get back on its feet?
We cannot do it really at the moment until most of the world is vaccinated. And in fact, in Africa, it's the biggest problem because the vaccination rate there is very low, and we need to solve that somehow. So the vaccination rate should be similar in all the countries.
Dr. Emilia Skirmuntt at the University of Oxford, thank you very much indeed for talking to us.
Thank you.